Good morning. We're here for one of the City of Superior Environmental Services Division businesses preventing pollution webinars. And today's topic is on managing waste from dental practices. And our speaker today is Tim Tuominen. And Tim started working on identifying sources of mercury to Western Lake Superior Sanitary District sewerage and solid waste processes in 1992 in a collaborative effort with the Northeast District Minnesota Dental Society, the Minnesota Dental Association, the Great Lakes State Dental Associations, and the American Dental Association. He, with others, developed guidance, improved waste management practices. Documents that have been developed during this effort are a guide for dentists, how to manage waste from your dental practice, recycling amalgam waste and other best management practices for your dental office, and blueprint for mercury elimination, mercury reduction project guidance for wastewater treatment plants. Tim has spoken at local, state, and national dental professional and waste management groups on simple waste management practices that dentists should employ in order to reduce their impact on the environment. He also developed waste management curriculum and conducted on-site training for dental professionals. So let's welcome Tim Tuominen.
Thank you, Wendy. I'm coming to you from our wastewater treatment plant in Duluth, Minnesota. It's called Western Lake Superior Sanitary District. We not only treat wastewater, but we also manage solid waste for the area or for the Duluth area. And we also have a household hazardous waste facility and a food waste composting site here at our facility, and materials recycling facility also. I guess I'm going to give you a little more background how somebody from a wastewater treatment plant gets into providing a webinar on dental practice waste management. Back in the early 90s, we were under some very strict mercury discharge limitations in our wastewater, and also we had a solid waste incinerator at that time that would emit mercury if it was heated up. So we were looking at sources of mercury to the wastewater treatment plant, and we found a few places that had already discovered Seattle, for one, and some Air Force bases in Texas had found that dental practices release amalgam waste, which are the gray fillings in people's mouths, to the sewer, mostly when they're removed. And we approached our local dental society and put it this way, that, you know, we have a problem meeting these local limits, and we would like them to help us collaboratively to see what we can do to reduce their impact. So we worked with them to put together waste management practices for dental offices, and it spread pretty far and wide throughout the Great Lakes states mostly, but when I see waste management practices employed by or recommended by other state dental associations, we find that they're taken pretty much from what we had put together in Minnesota. And we've had very good success of people changing their waste management practices. So I'm going to, first of all, I'm going to start by reviewing some of the things we're going to go over, and I'm going to list some definitions, talk about amalgam containing waste and some other waste from dental practices. As long as we're talking about it, we might as well not just zero in on mercury, but talk about the other wastes and how to ship, collect and store and ship these wastes, and then a little bit something that may be new in some parts of the country are, amalgam separators, which is a treatment system in the dental office that can be installed there that'll remove more amalgam from the wastewater stream. Mostly amalgam. Well, we'll stay in order of the slides here. Anyway, I'm going to talk a little bit about hazardous waste because some of the waste in the dental office could be considered hazardous. Flammable wastes are hazardous. Corrosives and toxic wastes are considered hazardous waste. And the good thing to know when you're dealing with amalgam waste or metal waste is if you recycle the metals that are listed as hazardous waste, if you recycle them instead of throwing them away, they are considered a recycled metal and are exempt from the hazardous waste rules. And that was a big thing in being able to manage this waste simply and easily from dental offices. Now, the reason we're worried about amalgam waste or this mercury-containing filling material is when it's heated up to incineration temperatures above 500 Fahrenheit, the mercury is released to the air, so it could become an air emission from either a solid waste, medical waste, or sewage sludge incinerator. Now, landfilling it might not be the worst thing you could do with it because you're not putting it into the air, but it also may just be setting aside a problem because landfills leach waste or water, and most of those leachates are sent to wastewater treatment plants. So sooner or later that mercury would get to a wastewater treatment plant. So here's my slides on recycling amalgam waste. First of all, chairside traps are one. There's a coarse trap in the vacuum system. So when a filling is being removed or replaced or placed, there's fine particles or gross particles and fine particles being suctioned out of your mouth, and that water would go to the sewer. In order to protect the vacuum pump equipment, there's a chairside trap, which is a gross trap, and that captures about 50% or so of the amalgam on that trap. It's very simple to manage that waste. You wear your utility gloves and glasses and a mask to prevent any bloodborne pathogen issues. And you simply put that in a container. When you're, first of all, you would, at the end of the day, you would want to flush your vacuum system. Most places do for odor controls. It's a disinfecting solution. You flush it at the end of the day, and the next morning take that trap out of the vacuum line, and you can either clean out the trap into a container or change the trap. You'd place it in a wide-mouth covered plastic container labeled amalgam for recycling. Traps from the hygiene chairs can be put in the garbage. They are not infectious waste. So you don't have to place them in the red bag, but you could. And that's just if a chair is dedicated to hygiene. Now, there's a second trap in a lot of vacuum systems. I call it a vacuum pump trap. It's a finer screen, and it's about like the size of a coffee cup, and it screws in. And those should also be recycled. The same way, put it in a wide-mouth container. You could clean it out into there, or if it's a reusable trap, or you could just put the whole trap in there if it's a disposable trap. Then what you want to do is send the traps or any mercury waste you have to an amalgam recycler. And most of your state dental associations would have a list of those recyclers. I know Minnesota, Wisconsin, all the Great Lakes states do, Missouri, and I'm sure that the places out, or a lot of states out west would have them. But I wouldn't be surprised if all the states have lists of who can process amalgam waste. But I would contact your state dental association first. If not, the ADA, on the ADA website or the state websites, they have that information. You can, there's a number of ways you can get rid of this waste. WLSSD has a household hazardous waste program, and it's also open to small business. It's called the Clean Shop. So we have a local program, and I know in Minnesota other counties have that. Whether other states do or not, I don't know. But there are vendors that manage amalgam waste and make sure that it gets managed properly and gets sent to us still. And your state lists have those vendors, and then also they usually have a list of recyclers that you could send directly to via UPS. So like I said, see your state dental association list. You could use a local or county small business collection program. And there are people that actually pick up door to door if you want that, but you pay a premium price for that. And you could send it by UPS from the vendor list. Like I said, UPS does haul amalgam waste. The Postal Service doesn't always do it. They go back and forth on that. So anyway, if you use these simple tips to manage your traps that you already have in place, you can reduce the amount of mercury going to the sewer by about 75%. There are other wastes. As long as we were doing waste management for dentist training, we figured let's train them on the other things too. Some of the wastes we talked about were X-ray waste, films, developer, fixer, lead foils. But what's even better nowadays, the real pollution prevention option is, like so many dentists are using now, are digital X-ray machines. There is no film, developer, fixer, or lead foil. So that's probably the best thing long-term that a dentist office could do. But these can also be managed quite simply. There's, for the list, there's we have fixer recyclers on our list, and on the State Dental Association list. Developer can be sewered. Add a little extra water if you do put that in, but the fixers and the films should be sent to recycler because there's lots of silver in that material. Like I said before, if you recycle a metal, it's not a hazardous waste. It's recycled metal. You can give it to somebody that has a recycling system, pay to have it hauled away, or buy a recovery system yourself for X-ray fixer. We charge based, we have a recovery system here that we can pour fixer through, and it costs us about $2 per pound of fixer. That would be approximately a gallon of fixer. A pound would be. Lead foils can leach into the groundwater at the landfill, so that can be recycled at a scrap yard. You could just see your yellow pages to see who's a metal recycler and haul it there. Or you could bring it to a local program like ours, or a county program. but it would go to the same place. We bring it to a scrapyard for recovery. Sharps are another item that you don't want to put in the landfill. You don't want a landfill worker or a solid waste facility worker getting blood a stick. And it's for infectious waste issues or blood-borne pathogen issues. So sharps, fluid bud, or soft tissue, not teeth, are infectious waste, and those need to be put, the sharps need to be put in a solid container. The fluid, blood, or the soft tissue need to be put in a red bag, and use universal precautions with a mask and gloves and glasses when you're handling those. A national firm that handles infectious waste is Stericycle, and I know Safety Clean a few years back when I made this slide was putting together sharps collections. I don't know if they're doing it yet or not. Most offices just need sharps disposal. That's what's most needed as far as infectious waste. Very seldom do they have fluid, blood, or soft tissue. Like I said, wear glasses, masks, gloves. When you're handling any fluid waste, even if it may not be considered an infectious waste because it's not flowing blood or dripping blood, why not play it safe and be careful? So you should store your amalgam waste in a container called amalgam waste for recycling. Keep it covered because it may cause odors if you don't. And don't store by floor drains. That's a waste rule. You don't want to have something spilled on a floor drain. Each container should have about 2 pounds of scrap or 5 pounds of traps. The rules say it has to be less than 1 pound of mercury per container, and UPS will haul it. Postal Service may reject it. Using our Clean Shop program is very simple here at WLSSD, and there's a number of these type of programs in Minnesota. You haul it yourself, but first you must call for an appointment, and we send you the paperwork, and we charge just what we have to cover the cost of the disposal. Right now, that's about $5 a pound for amalgam waste, $2 a pound for a gallon of fixer. Lead foils we don't charge for because it just goes to a scrapyard, and it shouldn't cost the dental office more than $50 a year to use WLSSD's program. We ask that people self-haul in the trunk or in a pickup box. It's not supposed to be in the passenger container, and carry papers listing the waste in the passenger compartment just in case there's an accident. Amalgam waste from the dentist, about 60% is captured on the chair. 10 or 20% is captured on the vacuum pump traps. These are most systems that are most used already, and so you can get up to 80% of the amalgam on traps you already have. What we did is, with the other 25%, we found that there was some pretty simple equipment that we could put into use. Because of the density of amalgam waste, it's quite heavy. It'll go, it'll settle out easy. So but the cost of these types of units are pretty wide, usually under $500. There's 2 types of vacuum systems, dry systems, and wet vac systems, you kind of have to know which system you have before you get a advanced treatment system. This is one, just a gravity separator in a dentist's office. The amalgam settles to the bottom. Each morning when you come back in, you drain the liquid or the supernatant off the top, and the amalgam sludge gets left behind, and about every 3 to 6 months you empty out that sludge and send it for recycling. Here's another type of unit using gravity and filtration, another one that kind of uses gravity through a centrifuge action. And the ADA has tested a number of these units, and they run mostly around 99% efficiency. They can run anywhere from $350 to $6,000, and the cost really isn't related to the efficiency. You may want to check what regulatory and requirements are in your area. Is it appropriate for your vacuum system? You could talk to your vendor about that, the cost. Let them know what space you have, because a lot of times vacuum pumps are crammed into tiny areas, and some of these could be too large for a real tiny area. And then you need to know what maintenance you need to do and how to dispose of the waste. What our program was all voluntary, and all of the practices in Duluth have amalgam separators. We have gotten down to 2 parts per trillion of mercury in our effluent, down from 15 before we started the program. And like I said, it was a totally voluntary cooperative program, although the dentist did use peer pressure to make sure that everybody was on board. And that's the end of my presentation. Wendy, you can take over, or if you have any questions, you could ask me.
Okay, well, thanks very much, Tim. That was good to hear the definite lowering levels of mercury coming through to the wastewater treatment plant. And so it was glad to, thank you very much for sharing that. I'm not seeing any questions come in. So here we are in Superior, and the expertise right across the bridge in Duluth is quite immense. And it's, yeah, again, very wonderful to see the progress that has been made in Northeast Minnesota, and let alone the training and sharing you've done nationally too, Tim. So thanks again, and good thing for peer pressure too. I like that at the end. That can be a part of making some things happen and keeping the environment safe. Well, this concludes this Businesses Preventing Pollution webinar. And we do have some upcoming ones, and all of these are recorded. They're archived, and on our website of www.ci.superior.wi.us/business. You can also do /webinar, and that will also access some other webinars we are giving and that are also being archived. Dentists might be interested in the September 18th Green Tier program through the Wisconsin DNR of, again, taking proactive steps and reducing environmental pollution. Thanks all for attending. Bye-bye.
Bye-bye.